All right. Good afternoon, good evening, and maybe even good morning to you. Welcome to UCSF Center for Global Nursing's Impact Series. This series aims to provide a platform for our nurses and global partners to share their remarkable work, offer valuable insights, and inspire our global community. Following the presentation, there will be a short Q&A, so feel free to write your questions throughout the presentation in the Q&A box. For those that don't know me, my name is Rebecca Silvers, Director of UCSF Center for Global Nursing, and it is my pleasure to introduce you to this month's two speakers, Doctors Adam Cooper and Jyu-Lin Chen. Dr. Cooper is our Director of Nursing Continuous Improvement and the Interim Director of Nursing Research at UCSF Health. He also serves as Director of the UCSF JBI Center and Co-Director of the Global Programs within the UCSF Leadership Institute, supporting leadership development and evidence-based practice programs. He received his Doctor of Nursing Practice from the UCSF School of Nursing and holds national certifications in both nursing professional development and EBP. Dr. Cooper is very passionate about quality improvement in EBP and teaches these at UCSF nationally and globally. At the Center for Global Nursing, Dr. Cooper collaborates with myself and the Tongan Ministry of Health and has helped roll out the first quality improvement fellowship there to uplift nursing and improve health outcomes in Tonga. This year, he also joins as faculty for our Certificate in Global Nursing program. We also are excited Dr. Jyu-Lin Chen is joining us. She is a professor and the Presidential Chair of Global Health Nursing, as well as the Chair of the Department of Family Healthcare Nursing here at the UCSF School of Nursing. She earned her PhD here at UCSF from the Department of School of Nursing and focuses her scholarly career on childhood obesity prevention, an urgent and preventable global health challenge with major implications for nursing research and practice worldwide. For more than a decade, her work has advanced the understanding of obesity prevention among children in China and among Chinese immigrants through a series of research studies. Dr. Chen has also mentored, matriculated, and provided special studies for students in many countries across the globe, from China, Korea, Japan, to the Philippines and Thailand, contributing to the development of the next generation of global nursing scholars. Additionally, these speakers are amazing. She serves as the co-director with Adam for the global programs at UCSF's Leadership Institute, where together they work with international partners through multidisciplinary leadership to develop and strengthen health systems worldwide. We are so honored to welcome both Drs. Adam Cooper and Jyu-Lin Chen to this month's Global Nursing Impact Series. And Dr. Cooper, I will hand it to you.
Wonderful. Thank you so much, Rebecca, and welcome everyone. Thank you for joining. We're excited to share and connect with you today in some of our work. So we'll start with just talking about the UCSF Leadership Institute to give a little bit of framing, and then we'll share some examples of partner programs that we are currently working with. So the Leadership Institute started a couple years ago in 2021 and is really a partnership between the UCSF School of Nursing and the UCSF Health System, where our hospitals are. And there are two main programs that the Leadership Institute focuses on. One is a variety of leadership development programs and one is evidence-based practice, EBP, development programs. And we'll talk about how we've incorporated both of those into our global programs. We do, aside from our global programs, which we will be sharing today, we do similar programs within UCSF Health with nurses and other professionals. We do leadership and EBP programming with some of our faculty and other partners around California. So it is a shared model that we incorporate partners from across different areas of the world. You can see some of the numbers here that the Leadership Institute has done in terms of the number of programs and participants. And at the bottom, you see the number of global participants. And some of this dates back even before the Leadership Institute started, as the UCSF Health System has had an EBP partner since 2015, which we'll share a little bit about. So let's dive in. The first example we want to share is related to a partner in Hong Kong. This is a hospital called HKSH, which stands for Hong Kong Sanatorium and Hospital. So the brief story of how this partnership was created was that we had a UCSF physician who was doing collaborative research with a physician from HKSH. And while they were over in Hong Kong, the director of nursing, which is equivalent to our chief nursing officer here, asked if she could connect with some nurse leaders at UCSF to explore if there were potential collaboratory initiatives that could be done. So myself, along with some other key leaders at the time, met with her, met with her team, and had a few meetings where we designed some opportunities. And they were able to secure local donor funding and sent six of their nurses to UCSF, and we hosted them for 2 weeks. And during that time, we designed observational opportunities where we partnered them up with nurses in areas that they worked in across our entire system. And our teams were very excited to share with them and share some of the best practices we do at UCSF, but also learn from them and some of the practices that they do in their institution. And it was really a mutually beneficial experience. On the very last day that they were here, we met with them to debrief about their experience. And we talked about all of the things that they learned and that they shared. And we got some questions, and they were asking, they really wanted to learn more about some of the things that they had seen where people were saying these were part of an evidence-based practice initiative. They saw that several times and asked if they could learn more about it. Well, they returned back to Hong Kong and we had continued discussions. And what evolved from that was those six nurses started an EBP fellowship with us for the next year. And we met with them virtually every month and would guide them through the steps of the EBP process. We matched them with mentors at UCSF and clinical experts to ask any questions about potential things that they were implementing, and worked with them all the way through towards the implementation of a new practice change in their area, and through evaluating that, collecting data on that, and disseminating that. So what you see here in a picture is an example of an event that they host where each of the fellows presents a 10-minute podium presentation on their project that they did during this fellowship. And they also create a poster highlighting their work. And outside of this room, all the way down the hallway, posters line the wall. And they invite everyone in their hospital and their community to join this event. And so it's a great way to both celebrate the work that these fellows have done, but also to highlight the details of their work as they disseminate their practices. So really exciting times. And after the first couple of years of doing this, other professions at HKSH became interested in this program, not just the nursing teams. And so slowly over years, this has become more interprofessional with pharmacists, dietitians, lab scientists, physical therapists, all joining as part of this fellowship along with nursing. And it's really been a strong relationship that has built over more than 10 years. We started as partners, became colleagues, and very much are friends that feel like family after we've worked together for so long. And it's really exciting to continue to collaborate together with this partner with our goal of developing them and working with them so they can be completely independent for their ongoing sustainability. Which leads us to where we are now. And their culture of evidence-based practice has really flourished, especially as they move into an interprofessional model. And we connected with them and developed a program that we could help train their faculty, train their teams to become faculty. And that's their a train the trainer program that we have developed together. And this started last year. This is our first year in doing it. And it's really a 3-year program. So they selected previous team members who have gone through the fellowship somewhere over this last 10 years, who have been mentors to other fellows, and who were interested in teaching future fellowship programs. And together, we are developing their own independent program. So for the first year, we are teaching together, where we meet with the faculty a couple of times a month, and some sessions where we are reviewing some of our content with them to refresh some of the ideas. Some of our sessions are practice sessions where they are teaching us and we provide feedback back and forth. And some sessions we are co-teaching the new fellowship team that has started last year. So that's year one. In year two, their faculty team will become more independent, taking the lead on all of the training sessions and the coaching sessions, and we will be there as a support, adding in as needed. And then in year three, it will be fully independent as they move on from this program and then able to do this as much as they feel like they need to. So it's been a really exciting evolution over time and a partnership together, and we're excited to see where it continues to go. With that, I will pass it over to Jyu-Lin.
Well, thank you, Adam. That was a great example of a long-term partnership, a relationship with the institution that, make a great effort of integrating EBP into practice. And so what I'm going to share with you is another initiative in the Leadership Institute. So we were fortunate to receive a philanthropic gift to really transform the healthcare, specifically improve nursing, quality of care globally. So I have the opportunity to partner with two hospitals in Taiwan and one big institution that have two hospitals in Thailand. So the two hospitals in Taiwan, one specifically focused on cancer treatment, so it's a cancer center. The other one is Jyu-Lin Hospital, that is a comprehensive hospital. So those two hospitals are in different part of the Taiwan. One is more the southern part of Taiwan. The other one is more the northern part of Taiwan. So this was a great opportunity for us to really even bring in the different institutions within the country. At Mahidol University, we partnered with the faculty as well as the two clinical sites in Thailand, Bangkok location. So we were able to work with them on leadership development, as well as similar to the one that Adam mentioned on EBP training. So Adam, next, please. So just want to share with you the recent leadership training we have just completed. It's called Academy for Healthcare Leadership. In this training, you can see on this slide that I, along with my colleague from UCSF Health. So I love this partnership. It's really a great integration partnership between academic and healthcare system. So we together with my two other colleagues from UCSF Health, that we travel to Thailand. So in this type of program that we have 5 days immersion in the country where the fellows stay. And then we also bring them, as you will see in the following slide, bring them to UCSF for them to have another 5 days immersion, which I'm going to share with you what they did during immersion. So in this Academy of Healthcare Leadership is more of similar to executive leadership training, that we teach them not only about leadership, but we have them conduct a project where they can actually practice the skill we have taught them and apply A3 framework and root cause analysis tool. So throughout the training, not only they learn the knowledge, but they also have opportunity to apply the knowledge to a real problem that they want to solve in the clinical side. And so it's really a great way of teaching that. And before we actually decide our curriculum, we conduct an interview with the key stakeholder of the institution, understand the perspective of leadership and the need for the leadership training. So we were able to collect the information from the fellow, from the manager, from even the director, CEO of the hospital, to understand what the expectation of the leadership in that institution, what they see as the need of the particular area that they would like to have more information. Some of the topic including change management, communication, and even financial management. So we design a program really align the need of the institution. That's why we work with the institution and design a program that really fulfill the gap they hope we will be able to help them to address. And I see this as also learning both. We learn a lot along the way by working with them about the institution, about their culture, and also different type of practices so that we at UCSF can also embed it and improve our care. Next, please, Adam. And so we have a program, similar program for the colleague in Taiwan that included 2 hospitals. What I have learned so much is that the cross-understanding, cross-learning between institutions, and in this way, when we bring them all to UCSF, it's the cross-culture that exchange idea and learning and different perspective, as you can see on the slide, that they come here for 5 days immersion. During the immersion, they would design some courses, content that are able to cross different trainee as well as different institution, different country. So they were together for 5 days, learning such as succession planning, such as their role as a EBP leader that helped to shape the transformation of the healthcare. And not only that, they were able to visit some clinic and even the learning center UCSF Health. And one of the things that we're able to do this year, we'll have them present their work because each one of them has a project that they take on and utilize the A3 learning framework and root cause analysis and the design intervention to really tackle the issue that they want to address. And during their immersion this time at UCSF, as you can see on the upper left level, that they presented their work as a poster. So they're able to share their idea with colleagues, mostly in the Bay Area, and learn from each other, as well as during the conference time, they listen to others' presentation. So this is really a great way for them not only to engage in learning, but also showcase the learning to the larger community and as a way to learn and share and get other contact and connection with colleagues in the United States. as you see in the lower left corner is that we have them do lots of exercise, meaning they have to move. This is the image that they are working on the cost benefit analysis to see what's the return on investment of their project. So we have them on this stage to think about what's the cost of your implementation or the resource use, and what is the expected return on investment. So they learn how they can articulate, not only they make significant clinical improvement, but financially they're able to also articulate what's the impact on return on investment. So we integrate those very interactive training and also as a way for to learn what the needs are and what they have done, the things that we could have utilized and we will be able to utilize at UCSF Health. Next, please. And just want to share with you some core. So this is the core for EBP. So we also provide training for EBP, similar to what Adam mentioned earlier in Hong Kong. So the EBP training that we go to the site to do EBP immersion, and we also have monthly coaching sessions. Same with the leadership training that we provide monthly coaching session, not only to provide some content, but also ensure we're available to give some idea, help them to brainstorm idea if they encounter any barrier or challenges. And this is the quote from the fellow, from the EBP, Evidence-Based Practice Training Fellow. So I'm just going to read one of them. The fellowship helped me to bridge the gap between research and practice. Since it is not always easy, my EBP project is once in a lifetime opportunity to learn from the best in my field and to build a strong foundation of scientific learning for bedside care. It's also one of the most impactful ways to improve patient care, an incredible opportunity, professional growth, and meaningful contribution to my field. So this is a quote from one of our fellows that speaks to the impact of the learning to them on the professional growth as well. So I have you sort of read that for the second quote. I think that we learned that our fellow really appreciate the EBP learning and also our way of coaching along the way to ensure EBP implementation can be successful. As we all know, nothing goes as you plan, but how do we be flexible as well as understanding the best practices that can be implemented to not only ensure change can occur, but sustainability of the change in clinical practice in order to improve patient care and outcome of our care. So next, so thank you for the opportunity for us to share our experience. And I think I want to echo what Adam said. Learning goes both ways. We learn as much as we're teaching them. So I really truly appreciate the partnership and opportunity with my colleague globally.
Amazing. Thank you guys so much for sharing your experiences in capacity building through the Leadership Institute. And it looks, you guys have put a lot of effort into bidirectional exchanges and learning in a multimodal way to really build evidence-based practice training. And for those not as familiar with that, Adam could provide us and Jyu-Lin with a very detailed explanation. But I think learning how to take the evidence and really put it into practice. We all know that that takes 17 years on average, and how do we do that in a more expeditious way to really improve health outcomes as research is generated? And so it's exciting to see that advance across the globe, as well as the leadership of nurses. We were talking about this in our certificate program of the call for nurses to really have opportunities and really grow as leaders. I don't see anything in the Q&A box, so I'll start with my first question, which is, when we develop programs with partners and we look at building these fellowships, we have similar capacity building stuff across the Institute of Global Health Sciences. What are the metrics that you guys look at for outcomes? Because when you think about, is it just the number trained? Is it the number? Is it the impact of their efforts? Or is your partners we are looking for a reduction in hospital infections of this? Are there targeted outcomes that you guys are working towards each year that are set by the organizations? Or is it more of a feedback mechanism? I'm just curious.
Adam, do you want to answer that first?
Sure. Great question, Rebecca. I would say when we first started the partnership in Hong Kong, I'll give that example to start. The metrics that we were looking for were more completion and knowledge. That's where we started. But once we saw the impact of the projects that they were doing, we started to, every year, we would meet with their leadership team to understand their organization priorities and started to align the topics that were chosen by their fellows that were aligned to those priorities. And so then we started to track the impact of the individual fellow projects on those outcomes. And sometimes fellows would be doing similar type of work, but in very different parts of the hospital. You know, someone could be in the adult ICU and someone could be in pediatric acute care, and they would both be working on reduction of some kind of hospital infection. The evidence sometimes overlapped and sometimes it was very different, but we would track the number of improved outcomes and then talk about that and debrief it at the end of the program with their leadership team to say, is this meeting what we wanted to meet? Did this meet our expectations? Were there other opportunities? And that would help shape what the priorities would be for the following year. In addition, we do evaluate, you know, the standard stuff. Do people feel like we do EBP competencies.
Mm.
We do that at the very beginning to see like it's a self-reflection on how comfortable you are with understanding the process of evidence-based practice. And then we do it again at the end to show that, you know, the amount of learning that has occurred throughout the program.
Yeah. So for the leadership program that we have, we do similar assessment about their leadership competency, right? How much they believe they have changed into the leadership ability in different domain. But one of the things that I learned, also I think the fellow learned, is that when you put money, when you put impact in dollars, that's what the eyes pop out. Or the CEO, right? Managers, oh my gosh, because imagine those colleague come for the training, it's a time commitment, right? Meaning the fact the institution have to allow them to come, the resource. So return on investment, not only we show the clinical outcome, even the fellow, their professional growth, right? How they feel about them as a nurse, as a leader, it's important to that retention of a nurse, right? Especially the senior nurse, nurse manager. Now we're also able to teach them about how to translate into the financial impact, which sort of sometimes speak very loud about those type of training is very impactful. Not only they reduce the infection or fall as one of the outcome, but they can also improve the financial status or financial outcome of the institution.
Great. And I have two questions. The first one is you guys do, or you've talked about some multidisciplinary, interdisciplinary collaboration and work. And I'd love to hear your thoughts about the benefit of bringing
Well,
professions together in this type of capacity building environment. I think it's something we always talk about in global health,
yeah.
is that elevating together really makes things almost exponential. I'd love to hear your thoughts about that in these projects.
Oh, I completely agree with that. You know, when we started, a lot of this work was very nursing focused because that's where we come from. And as we know, healthcare is not any single profession. It all exists with an interprofessional, teamwork, collaborative approach. And so the more we can have these integrated interprofessional sessions, the participants learn from each other.
Yeah.
They support each other. And when people are actually implementing into practice, others are involved, whether or not you anticipated it or not. And so to have your interprofessional colleagues supportive of this really not only improves the overall culture of using evidence into practice and into leadership development, but also helps with individual implementation success.
And one thing I will add to that is it actually also help elevate nursing, right? Because we're working together. You have your responsibility, I have my responsibility, but together, right, how we can lead the change together. And sometimes, many times, this project can be led by a nurse, right? It actually help us to let people know what we can do to elevate the patient care.
I love that. And then one quick question from our audience. Based on your experiences in global nursing with partnerships in Taiwan and Hong Kong or elsewhere, what has been the most valuable insights and the greatest challenges you've observed from collaborative project, especially in pediatrics?
In pediatric,
I see you, Jyu-Lin.
I know, it's like, well, I work with the kids. Well, I think that not the challenge per se, but understand different practices, right? Because what US nurse can do or would do is different, right, in different country. The scope of practice, even the cultural practice is so different. So one would not judge the other about authority or your responsibility, right? But learning from each other. So that's why it's not a challenge, but it's actually helped me to understand how different nurses practice. Our scope of practice may be different, right? Some country probably function almost like a physician, right? Others, you're very restricted scope, right? It actually helped me and also others to understand what one can do. And this is why when you design intervention, it had to be evidence is one thing, but feasibility within the scope of practice is the other. So actually, I appreciate more about the diversity even within nursing profession globally.
Yes, 32 different versions of what we do in the world. And we talked about this in our certificate program this morning and just um, how different our roles are and how much we must come to one another into partnerships with so much to learn because
Yeah,
as you mentioned, Jyu-Lin, some people, the advanced practice nursing through task
yeah.
shifting has it been available for a very long time across the world.
Mhm.
And we all practice so differently that we all have so much to learn from each other, which makes it challenging in that
Yeah.
things take time, but not challenging. It makes it enriching and exciting as we move forward in partnership. Adam, any last words to add before we close out for today?
No, well, the only last thing I will say is that it's exciting to open your eyes and your hearts and your arms to partner with colleagues across the world. We have so much to teach and learn from each other that it's really feels like it's one big family.
Yes, thank you so much to Doctors Adam Cooper and Jyu-Lin Chen for joining us today and sharing the remarkable work at UCSF's Leadership Institute and their amazing impact on our own institutions, the School of Nursing and UCSF Health. We're so lucky that you're here with us. And to your global colleagues, we say thank you and excited to see them again on their next visits. Thank you to our community for joining us today. We will be at this time for the next 2 months, and the next two presentations will be colleagues of ours from the Asian and Pacific islands. So they are awake now. And so we're accommodating our global community and excited to do so. So thank you, everyone. Have a wonderful January, and we'll see you next month.
Bye.